Yeah, well, I think for kind of all junior doctors working in psychiatry, the problem of kind of physical health or managing the physical health of patients is really obvious for us and kind of really stark. And it's something we see every day, that these patients have kind of complex physical health needs. And that's also seen in kind of research evidence that we know that patients have a reduced life expectancy compared to the general population. But at the same time, there's this kind of paradox that we really struggle to access physical health services for these patients, who are probably some of the most needy and vulnerable patients that we look after. So working as a kind of junior doctor, we see this a lot, that it can be really difficult to access physical health advice and support for patients with psychiatric needs. So I became really interested in how we can find interventions or explore interventions to better get physical health support for patients in psychiatric settings, which is both the kind of practical problem I think about how services are organised and often separated between mental and physical health at different sites and locations, but also, a really kind of pressing medical problem that has real health consequences for these patients. Yeah, I didn't actually have any experience at the clinic. I wasn't working on one of the wards where it was live, but I wish I had, in a way. Working on the wards I was working, had lots of frustrating experiences trying to contact senior doctors at other hospitals to get physical health advice, and sometimes actually referring patients or transferring patients to A&E, probably unnecessarily, because it was the quickest and sometimes only way to get that physical health advice. Yeah, so we interviewed about 8 doctors, generally quite junior doctors of the kind of foundation year level or early trainee doctors in psychiatry, who are often the kind of doctors who manage physical health needs on the ward. And we discussed with them their experiences of using the physical health clinic. And they described that really it was seen as quite a good option for the kind of physical health queries that were about non-acute issues. So not the kind of issues that would need somebody to be transferred to A&E, but also issues that weren't maybe confined to a single medical specialty. So they might be complex or involve multiple different medical specialties, perhaps the kind of issues that would normally be managed in the GP setting or by a kind of general medical clinician. These might have been kind of chronic health problems, perhaps abnormal blood results, non-urgent symptoms, or sometimes actually, quite often, we doctors reported using the service for concerns about malignancy or cancer. So respondents kind of aimed to use the physical health clinic, and we're usually hoping for some kind of advice on perhaps formulating a management plan, thinking about perhaps changing medications or ordering investigations. But also, actually, we saw that doctors were often just looking for reassurance, and that doctors are very used to working in teams where they have somebody senior they can escalate concerns or queries to, but that actually working as a junior doctor in psychiatry, there's not really anyone to do that from a kind of physical health perspective. And they really valued that aspect of the physical health clinic. So in terms of the feedback that doctors provided about the physical health clinic, they reported that the referral was easy to make, it was a straightforward form, was simple and very quick to complete. And then thinking about the outcome of the referral, all the doctors said they were satisfied with the kind of service they received. They reported that the physical health clinic team were approachable, friendly, helpful, and particularly valued that the consultant was familiar to them. It wasn't this distant, unfamiliar consultant who they were getting advice from, but it was somebody perhaps they knew or had experience of working with in the past. They reported that they would receive kind of clear and detailed plans about patient management. And they reported that they always would follow these plans and act on the advice provided. And really kind of positively, the vast majority of respondents felt that this had a really direct positive impact on patient care and patient safety. And they felt that physical health issues would be resolved quicker because of the physical health clinic. And that actually it kind of provided what they described as an expanded MDT, this sense that there was somebody now in the MDT who offered up-to-date physical health knowledge and senior expertise of who they could escalate these concerns to. There were some recommendations of how it might be improved, doctors kind of wanted some greater clarity about exactly which patients or which patient cases should be referred to the clinic. And they also wondered if it could be better integrated with other sources of physical health advice, such as the Consult and Connect service or transferring patients to A&E. And they also wondered if the service should be publicised a bit more widely. But overall, the doctors really reported that it was a really valuable service, that it saved clinicians time, but most importantly, that they felt that it really made junior doctors feel safer and more confident in their work. Yeah, I think doing this project really highlighted to me that we need to think about how junior doctors can access physical health support and advice for the psychiatric patients they work for, because there is this real paradox that these are some of the most vulnerable and needy patients from a mental and physical health perspective, but yet it seems often that it's hardest to access the support for them. So I really think it's relevant to think for mental health providers to think about the routes that patients have to access physical health support. And that's not just for immediate or acute concerns. It's also for these kind of chronic, complex and multi-specialty physical health concerns that the patients might have. And I think this project shows that actually quite a simple intervention, just having quick and direct access to a senior physical health consultant can go a really long way. But also that there are kind of human factors things around that having a named consultant who's consistent, who's familiar with the junior doctors, but also who's just approachable and friendly, who provides time and advice that doctors can trust because they know it's not rushed, or they know it's somebody who's genuinely interested and invested in supporting patients with psychiatric problems. Well, that stuff can all actually really go a long way. And most importantly, it can have a really positive impact on patient care and patient standards.